Well, welcome to another Cutting Edge show. I'm Omar Neal. I'm one of the hosts of this great program where we discuss all things health and wellness. It's brought to you by the University of Maryland School of Public Health. And, I can't do this thing without my dear friend and co host. And that's nothing other than the man with the plan, Dr. Stephen B. Thomas. We call him Dr. T around these parts. Hey, Dr. T, how are you doing, man?
Mayor Neal, I am telling you what, an amazing day here in the Metro DC area. We started out with all this humidity and heat. Not long ago, we had coats on. And then in the middle of the afternoon, the wind starts blowing, rain comes, and all of a sudden the temperatures drop like 10 degrees. It's beautiful out there. And that's what this COVID's making me think of. We get these moments when we're in the storm. And then we get a clearing and think, oh, blue skies and the sun shines out, not knowing there's another storm coming over the edge. And so I love what we're talking about today. Don't let down your guard. Keep your vigilance up. And, throughout the civil rights movement, that's what Black people have had to do all the time. So we're going to have to save ourselves with the methods our ancestors left for us.
Man, I like this, the theme of this particular show. Spring has sprung, but COVID ain't done, So,
another Omarism.
I'm telling you. Oh, man. I think we talked about spiking the ball on the 30-yard line. That's not a touchdown. That's a fumble. And I think that's the work that we have to do, is to get people to understand that we need to do cost benefit analysis for everything that we do, because we have to move from this notion of this going away at some point.
That's right.
To maybe the realization, and Dr. T, you said this very early in the game. You said we're probably going to end up with an endemic, that this pandemic will move into an endemic stage, and we are probably going to have to live with this. And many people thought that you were being pessimistic when you said that, but I don't know if you got some kind of crystal ball, but you were right.
But, the thing about pandemic means worldwide. So we let this thing rage in Africa, South America. Think of the poorest countries in the world. If we let it grow, guess what? It's coming back to us. So we have to address the globe. But what I want to make sure is that that we don't lose our own communities here, and that Black and brown folks aren't left with the disease in their communities. And therefore, we're going to find that acceptable. Hey, Mayor, you remember when you used to say, how many deaths would it take to wake up? And you said, imagine 50 people behind you. Is that enough? And then you said, what? Those 50 people are your relatives. Okay. So at some point, when it's my family, one is too many.
Right.
So how can we begin to look at one another as part of a broader family? And you know what else, my friend? We've talked about these social determinants of health. One of the vaccines metaphor in that context is voting.
Yeah.
They're passing laws right now that would restrict the ability of public health to protect the public, passing laws right now that restrict our ability to tell the truth about our history in this country. That's happening as we speak. And the war is taking over the front pages. So we've got to keep our show going, keep pushing out our message, and let people know we're not going anywhere until we save ourselves.
Well, that's a lifetime journey we have. But let me, the point of the matter is, we don't do this by ourselves. And it's important that we note our fearless team behind the scene. We have a group of people who are dedicated to making sure that we have the most professional production done each and every week. It's headed up by Meg Jordan, who is our technical director, Maggie Daly, assistant technical director, Saraya Khan, who is social media guru and communications. We have Kimberly Fleming, who is our social media and media curator. And of course, the sound designer is Elijah Pugh Jr. You see how all of them are smiling? You notice that?
Yeah,
That's the cutting edge, Mike.
there you go. Hey, Mayor.
Absolutely. Uh-huh.
Every now and then things line up, and that's
Right.
happened this weekend. Good Friday is tomorrow. So we
Right.
got Easter coming. Guess what? Saraya is in the midst of Ramadan,
Ah,
and Meg is in the ready for Passover. All of those things are coming together right now. And therefore, what? People are coming together, gathering from around.
right, right, right.
And my question is, my question, who are you sharing air with?
You have made that emphatically clear, Doc. I mean, in fact, we talked about how you frame the issue determines who embrace the cause. You have really, and I think about that every time I go somewhere. Who am I sharing air with? And then if I'm not comfortable, the mask goes on
There you
immediately.
go.
And I think you've also said something. Keep masks in your pocket all
Yes.
times. Have 3 or 4 or 5 in around you all the time.
There you
Always
go.
have it in your purse. Have it in your jacket pockets. Whenever you leave the house, never leave the house. It's like what's that? Never leave home without it. What's that? American Express card.
There you go.
Never leave home without it in terms of the mask.
But
That's where we need to be. Mhm.
You live in a part of the world where you put your mask on and walk into the grocery store down in Alabama, people may look at you funny, or in Texas. So what do we tell our folks when they put that mask on and they get looked at funny?
Well, this is how I see it. If you can't die for me, I'm sure not going to let you live for me. I'm putting my mask on. That's it. Point blank.
There we go.
All right, let's move on. Man, we really are so appreciative to be here in this month. We salute the National Minority Health Month. We had Black History Month in February. Women's Month was March, and now we celebrate the National Minority Health Month. And this is special to me because of somebody we're going to talk about a little later on that happens to be special to me because of I can't tell you, I can't let the cat out the bag now, but we're going to talk about it in a minute, right? But this whole notion of we talk about the health disparities, and that's what you run. That's what
That's
you
right.
have always looked at is how do these health disparities impact the quality of life for people who are marginalized, right?
Yes.
How do these comorbidities are influenced by and exacerbate COVID, right?
Right.
I mean, all of those things we really talk about in a very candid way, and that's what the cutting edge is about: is being honest and candid, not academic, honest and candid, telling the truth as we understand it.
Well, Mr. Mayor, there's another surprise we'll have a little bit later, and that's how do we take the academic and translate it into, as you say, language that's plain, simple, straightforward to give people information they need to make decisions.
Absolutely. So that's what we're doing. But again, people got to find us, and so we are finding them where they are. So you can check us out on Facebook, YouTube, Instagram, and Twitter. And of course, make sure that you like, share, subscribe, and like, share, and subscribe again, and keep doing that
right
until everybody has connected with the show, the Cutting Edge. And you can also use the QR code and go and sign up for our newsletter, which is magnificent. Maggie Daly is just really doing a yeoman's job in putting out information, relative information. We doing snippets of our show. All of that is being done each and every week. So you really, it's dynamic, and that's what's so incredibly important about what we're doing. Mm-hmm. What we're doing is dynamic, and so I'm so excited about it, man. So again, everything we're doing is based on keeping information in front of people.
Absolutely.
Now these people here are connected to the School of Public Health. Tell us a little bit about what's going to be happening next week, Dr. T.
Well, one of the things we've done is that we've listened to our barbers and stylists, and we'd have to go back a few shows. I think it was Dynamite Brown who said to Dr. Osterholm, you got to break it down like you're talking to an 8th grader. I've never forgotten that. because we're asking people to be epidemiologists and all kind of experts in a fairly crash course. So we brought on some artists, Jasmine Mitchell, Marcus Ford, and Olgar Joe Wade, who they're working on the Barbershop Storybook Project. Wow. And they have produced the pitch. And what they're going to do on Wednesday, and folks can just put their phones to that QR code and you can register. They brought in some other actors, Omar, and they're going to do a reading of the draft of the Barbershop Storybook. And we want everybody to come and have an opportunity to give some input. This is the kind of innovation, translating the science, medicine, and public health into culturally tailored interventions and communication formats that our community will embrace. And these will be distributed throughout the Barbershop Network. So come and participate in the reading next Wednesday, 5 to 6 p.m. Eastern Coast time. QR code there. And you can also just Google go.umd.edu/BSP.
Yeah, well, thinking out of the box is what we do here. And we have to come up with all different ways to convey messages. And this is a great way. The arts, in fact, there is nothing that cannot be transmitted through the arts. Mm-hmm. And this is a good way to leverage something that we already have a great affinity for, and we can get information so we can have infotainment.
There you go.
We're being informed and entertained at the same time, right? That's what you call infotainment. Man, can you imagine what kind of lineup we have today?
Oh man. Buckle your seatbelt.
Buckle your seatbelt, man. We have attorney Crystal James, and I'm going to talk a little bit about her because she's a Tuskegee person. She works at Tuskegee University. But man, everywhere I go around the state of Alabama and I'm talking about, COVID and that kind of thing, they ask me, well, do you know attorney Crystal James? I say, yeah, you know how you want to, you want to do some name, dropping names. Yeah, I know her. I know her well, right? And then that gives me a little bit more credence, a little bit more bona fides, with knowing that I even know her. So we're going to talk with her. She is the special assistant to the president for COVID-19 recovery at Tuskegee University. So we are part of a task force, and we meet every Saturday. And she is just so knowledgeable in this space, and so I'm so excited to have her. Introduce Valerie Davis for us.
Here in Prince George's County, Maryland, which is a county of 1 million people, 60+% African American, 20% Latino, and many other cultures here. Valerie and I have been part of a coalition since the beginning of this pandemic. We call it the Solution Space. And I've gotten to know movers and shakers. And after our last meeting, Valerie gave me a call and let me know that she had deconstructed Stacey Abrams' playbook on what it's going to take for us to address many of these social determinants of health. Yes, it requires us taking self-responsibility, but it also requires us to be civically engaged and to vote. Mm-hmm. This is why that's so important. We're going to talk about that tonight.
Oh, that's wonderful. Well, let's get to it. I mean, let's, if we're going to do it, let's do it. I told you that we were going to talk about an individual, Dr. Booker T. Washington. He's the founder and first president of Tuskegee Normal and Industrial Institute, now known as Tuskegee University. And I would consider him, and I may be a little biased on this, prejudice, if you will.
Just a little.
Right? Just a little, right? He's the best president in the whole United States world kingdom, right? Okay, there has never been a better president. And the more I read about him, the more I know about him, the more enamored I'm with him, right? with him and his legacy, right? And if you don't know about Dr. Booker T. Washington, I want you to do some homework and really just look him up. And not only did he deal with business and all of the other things, not only was he engaged with presidents and philanthropists to bring resources into Tuskegee, but he was also a very critical in dealing with health.
Yes.
If you look at the next slide, this whole we talking about this minority health
Yep.
a month. He was the first person who just even put this together. In fact, look at his statement. Without health and until we reduce the high death rate, it will be impossible for us to have permanent success in business, in property getting, in acquiring education, or to show others evidence of progress.
Yes.
If we don't have health, we have nothing. Health is your wealth.
There you go.
Right?
Look at that date, Omar. Look at that date, man.
Right. 1914.
Mm-hmm.
Right. That was right before his death. I mean, like this was like
that's right.
That was his admonishment to us. Right.
It was the following year, 1915, that they first launched. It was first called Negro Health Week and became National Negro Health Movement. And now we have it as National Minority Health Month. And we've had people like others in the public health field lift this up as well. Caswell Evans, former president, he's a dentist out in California, done marvelous work to bring Minority Health Month back into the modern age. And so if they're out there listening, Caswell, thank you. This is our playbook moving forward. It's been here all in front of us the whole time, Omar. Mm-hmm. We need to dust it off and use the playbook our ancestors have left us.
Yeah. Okay. Well, let's bring forth. I told you about Attorney Crystal James, right?
She's right? From Tuskegee.
What did I say? I mean, let me tell you something. When I brag on people, that people when you meet them, you don't know whether or not to shake their hand or touch the hem of their garment. I mean, but Attorney Crystal James, man, is such a consummate professional, man. She's so dedicated. She's so pleasant. She's such an easy person to work with. It's an honor. Really, it is. No hyperbole. It is an honor to know her. Mm-hmm. Ladies and gentlemen, please join me in welcoming a dear friend, a colleague, Attorney Crystal James.
All right. Hey, some snaps.
Attorney James. Absolutely.
Snaps. Welcome.
That's just high praise. Thank you so much, Mayor Neal. I don't even know how to follow my own introduction. I appreciate all of that. It's been a pleasure to listen in and to get all the knowledge that you guys are sharing in this space. It is important that we carry the message and hollow it from the hills, as my grandmother used to say, to all of our people. Get the message that we have to stay vigilant and it is not over. So thank you so much for allowing me to come in, and I look forward to engaging in the conversation.
I just love her virtual background.
Well, you know what that is, right?
That's Tuskegee, maybe she's going to tell the story. What are we looking at? The veil
of ignorance. That's the baddest statue in the whole United States world kingdom, too.
Exactly. This is worldwide, internationally known. This is Booker T. Washington lifting the veil of ignorance from the slave and actually raising them up to be the scholars that came out of Tuskegee Institute and now Tuskegee University. So we continue to do that. It is our mission to not only lift the veil of ignorance for our students, but for our people throughout the Black Belt, as well as the state and in the country as well.
Thank you so much.
There's a lot of symbolism there and relevance, right, to what we're doing today. So
yes.
So we're going to talk about all of that. But Attorney Crystal James, thank you so much for agreeing to join us today in this conversation. All right, Dr. T, you bring up the next person. I'm going to let you do your thing.
Well, Val Davis is also an attorney and a master's in business administration. And I say that knowing that Booker T started the first Negro Business League. Look how many ways in which he organized us. Yeah. And so Val Davis and I have been on this coalition together. You can see all her background and contact information. But what really struck me is that she is fearless. And to speak truth to power, like we have to do on these calls when you have funders on the line, recognizing that this is no time to sanitize the conversation. Val brings it all the way live, put your snaps together for Val Davis. Hey, Val, welcome to the Cutting
Attorney
Edge.
Davis, how are you doing?
Thank you. Thank you all for having me. And thank you for that wonderful introduction. I feel like I'm in rarefied space with all y'all.
Rarefied space. I love that.
Right?
And you know, Val,
Kings and the queens.
people could see the details, but in your own voice, in your own words, what do you want this audience to know about who Val Davis is?
I am determined to expend my last breath to make this world better for my 14-year-old daughter than it is today.
Okay.
Period.
Mm-hmm.
That's it.
A mother's plea.
That's so profound, because isn't that what it's all about? I think about our foreparents and the sacrifices that they made, that maybe, we can be the hope of the slave. And with Attorney James with us today, do know that the new justice, right, is her mother graduated from Tuskegee.
Oh my goodness, here we go.
Attorney James, would you please introduce the new justice to our people? Would you please tell them the association, right? Booker T. Washington, the new justice, the first Black woman justice in the history of her mother, graduated 1967.
All right.
From Tuskegee, 67, 68. Someone else in that area. Go ahead.
Well, Tuskegee is the place where all greatness springs forth, and it goes on to generations and generations. And the Venerable Justice Keandre Jackson is just the manifestation of all the hopes and dreams of Black women attorneys across this country who know what that struggle is, to be in that space and to do it with such poise and with such dignity. And even you look at all of the educational pathways and the sacrifice she made in pay to be able to understand and serve at every level of our judicial system is just a testament to her commitment. And I'm excited and ecstatic to see today when she raised her hand and gets sworn in for life.
Yes.
The highest court of the land. And so that we, if you did not have an opportunity to watch during that process, please take a moment to just if you watch nothing but the 11 minutes that Brother Booker,
Cory Booker,
absolutely,
actually lifted her up and elevated her to where she should have been through that entire process. And it made me feel so good as a Black woman attorney to have a brother stand in the gap for her and make sure that we put our attention back to what was important. And that is the fact that she has done all things that should be done to meet the pathway and to be greeted there with open arms.
That's right.
So we're very, very proud. And I can't wait for her confirmation.
Absolutely. Well, she's already been confirmed, so she's good.
Yeah.
Her swearing in.
Yeah, swearing in. Swearing in. That's that part. Yeah,
that part.
That's just academic at this point. We just go.
Right.
That's process right there. Okay, so let's have the conversation.
Just real quick.
Go ahead.
Real quick. It's a little thing. It was a caption in the newspaper. It had her photo. She was smiling. The caption said, "It made a big difference that she showed up with sister locks." That was
I was thinking about that.
Sister locks.
Absolutely.
And Ms. Davis just talked about her daughter. How important was why was that important?
Well,
I'm sorry, go ahead.
No, both of you. We're gonna give both of y'all this opportunity. Go ahead.
Because we talked to barbers and stylists out there. Why was that important?
I was reading today just the highlights of a Pew research study, which asked the question of the study subjects: how important is the acknowledgement of your race or ethnicity to you? And what they found was that Black folk, particularly African Americans, have a multiplier in terms of how important it is that we be recognized connected to our race and ethnicity. And I was thinking about that thing because I didn't get to read this. I'm one of those, nerdy people that I read everything. I love to read. I want to know, and then I pray about it and eat the meat and spit out the bone. But I thought about
you,
that thing.
You from the South or something?
like
I mean,
that
you put it where the cows can get it. I mean,
Eat the meat, spit out
Well,
the
that's because
bone.
my parents are from Mississippi.
oh, okay, all right, okay. I don't
Contemporaries
have to
with
say
Fannie
anymore.
Lou
Okay,
Hamer,
now I know. Now I
had
know.
Reverend Dr. Martin Luther King at the house. That's where I come from.
Okay. I knew it had to be something. I didn't know what it was, but
Mississippi.
you could tell. I saw you when you pulled up. You didn't have to blow.
So I was thinking about that, and I was like, well, why would that be? I mean, there are many reasons, and it goes to your question that when we, in particular, as African Americans, when I say Black, I refer to the Black diaspora. Whoever wants to
Yes.
identify as having
Right.
connection to the motherland, then you Black, in my view, and in the view of Elevate Her. But African Americans in particular, when you've been stripped of your identity,
Yes.
I'm gonna need you to say my name.
Mm.
And I need you to recognize my right to show up however it is I want to show up. Sister locks and all. And so when we see that, we respond to that.
Mm-hmm.
And then you pick up the phone and you look at Twitter and they say, why does it have to always be about being Black?
Well,
And to which I say,
yeah.
have several seats.
Don't take a seat because we got some
Several.
time. You need to
Because
sit down.
I'm not going to explain that to you. Your decided and intentional ignorance about the land in which you live is your responsibility. We don't need to, in this moment, explain to you why it's important that we think something is as trivial in your view as how we style our hair, which requires a law for us to have the right to do it, the Crown Act.
Yeah.
I don't need to explain that to you. Have several seats and get a book.
I told you she don't play.
Well, that's why we call this the cutting edge.
That's right.
Because we don't mind cutting it straight, right?
There you go.
But
All right,
I
Attorney
still agree.
James,
I might
what's your
speak to
thoughts?
that as well. I think because in these spaces, especially, once you graduate from law school, you go through the schooling process and pass the bar, you are told that if you want to be successful in this white male-dominated space, that you need to conform in every way if you want to be successful, especially if you want to go into a space as traditional as the bench. That's a space that has been, we're in 2022 and we're just still getting first, not just at the Supreme Court level, but at some county levels, getting our first Black woman judges appointed. But we're told that we must wear our hair in a way that is going to be normalized or normalizing and make other people feel comfortable and think that we're not going to be a radical or more pay more attention or give more attention to Black issues than other issues. We have to actually try our best to assimilate, not just in thought, but in clothes, in the way we show up, in the way we speak, in the way we relate to other people, because we also are battling this angry Black woman image, right? So we have to tone ourselves down in our earrings, the jewelry, how we adorn ourselves. And for her to show up in that space with her sister locks, not only elevated to the space
did it
of
speak
Black
volumes?
Woman, it spoke beyond, but I mean, it yelled, it screamed that I am woman, I am Black woman, and I am prepared just the way I am.
And not afraid of all the trash they threw at her.
Right.
Right.
When I was at before I skipped out of corporate America and did my own thing, which I was destined to do. I had sucked all the life that I could out of being in corporate America. I worked at Fannie Mae, and I was a little Black girl with an MBA, working in the office of the chairman as the director of corporate strategy. Not supposed to be there under any circumstances. And every time I would show up for a meeting, they'd want to make me, the secretary. I was like, no, that's not it. And then I went on vacation to my favorite island, St. Lucia. And I braided my hair. I no one at work knew that I did that. How you prepare to go on vacation, get your hair braided, but I didn't have time to get it undone before I came back. Cause I know the rules, right? And I was like, you know what? I'm just going to go in here. And then I went one day and I went 1 week and I went 2 weeks and I was like, I think I'm going to wear these braids, right? But at some point I had to get them taken out, and I was just getting them taken out to change them. The day after I took them out, 3 Black women throughout the day showed up in my office in tears. And they said, why did you do it? The first one, I was like, I don't even know you. What's up? Like, why did I didn't do anything to you. I'm thinking HR, what happened? Right. And one by one, they proceeded to tell me how, even though they didn't know me, they were watching me. And the idea that I had the courage to put braids in my hair and go before Frank Raines and the chair, first Black CEO and the leaders of Fannie Mae in my braids, it just released them to do so. I didn't even know I was doing anything. I was just going on vacation and didn't have time to get the braids taken out. Right. Well, and they weren't just expressing it, they were crying that I had taken them out because they were like, they wanted somebody to give them permission.
Right.
And it was stunning to me. So yeah, it's something. It's something.
Role modeling matters.
But it is.
Yeah.
Role modeling matters.
I want to move into this space. More is caught than is taught. People learn best by precept and example, right? And so I want to move us into the space of COVID and the trauma that we are experiencing in trying to adapt our lives to this new normal and trying to live through it, right? And not just go through it, but grow through it, right? And with the mismessaging, the disinformation campaigns, the misinformation campaigns is creating confusion for many people. And so many people are making decisions about life and death from Twitter posts and Facebook posts. How do we get people to truly settle into the notion that information is power, and that information as it relates to COVID can literally be a matter of life and death? I'm going to start with you, Attorney James. Go ahead.
Well, to tell you the truth, Mary Neal, if I had the answer to that question, and for real, we could get to health equity like this, right? And that is something that we struggle with, not only with COVID, but for many health disparities that we experience. But what I found in talking to people about mitigation is helping them to understand that you don't wear that mask for you. You're wearing that mask for your grandmother.
Yes.
Wow.
You're wearing that mask for that little baby that just was born and don't have an immune system yet that's able to deal with the things that are there. So if you don't care enough for self, how would you feel if you took something home to Big Mama? How would you carry that? How would you feel if you impacted your own child with something that you could have easily kept away if you just masked up and continue to wash your hands, continue to make sure that when you've been in spaces where you're not sure about, that you take those clothes off before you get home and lay on your couch and get in your bed, and so that you can wash them and make sure that that's your home space, that space where we all want to feel like when we come in, we're safe, that you're not bringing danger home. That's I found to be most impactful, and that kind of gets people to think about it in a different way, because we have this notion of, I have my liberties, no one should tell me what I can do with my own body. You're absolutely right. But your liberties end where mine begin. Right? So while you perfectly have in these United States the ability to do what you want to do with your own person, when your decisions start to impact other people, okay, if it's John Q. Public and you don't know that person, maybe you don't care, but maybe if it's your mom or your grandmother or your auntie or your cousin that has a compromised immune system, and now you've endangered them.
What about even ourselves? Because we don't know how COVID, how we're going to fare with COVID. So even if it's not Big Mama, because I may be in a city where I don't have relatives. What about me? Should I not play Russian roulette with my life as well? I mean, I think when you have a appreciation for life, then you try to do all of the things that you can to sustain your life. And that has to do with your behavior when you're in the midst of a pandemic as well. Oh, we're talking about close to 1 million people. I think we're talking, and I hate to do this projection, but they're talking about next month, it'll be 1 million people die from COVID. If the trends remain the same.
And the time period is so compressed.
Right.
And so Attorney James, it's not about me, it's about we.
Right.
And that's the difference between, individualized medicine. You can make a decision with you and your physician whether you take or not take something.
Right.
But on the public health side, it's about the public good. And so, Valerie, when I look at Elevate Her and the public good, are you able to get that message across? Or are you also finding in your constituency this, I don't want anybody to tell me what to do? Imagine if we walked into a restaurant restroom and there was a sign that said, instead of all workers must wash their hands, it said workers can make their own decision. We would be up in arms. But you can see how that logic would play
depends
out.
on how good the chicken is, man. All right, okay.
Elevate her.
I digress a little bit.
Okay,
okay, Attorney Davis.
Did he say the chicken? Okay. Wow, that you threw me all off because now I'm in a different place. Okay, come back. I'm gonna tell you 5 things before I answer your question.
Okay.
5 really important things that we have learned being an organization that was started in the pandemic, September 2020.
Elevate Her.
Elevate Her was a nonprofit started by 9 Black women who just got on a Zoom and said, 33,000 Black people are dying every day. We have to do something. That's literally how this started. We didn't have money. We weren't in this, we didn't have anything but an idea. And, now more than 2 years later and 8 grants and 3 contracts from nothing. I'm gonna tell you about, I could tell you about a faith walk. Maybe that's another show. Not a dime, not a dollar, no time.
No, hold on. We can do that in this show. We can weave faith in this show. You ain't got to shout now, but just bring it in here. That this is a safe space for that. Go ahead.
I could tell you about all that, but here are 5 things that are pressing up against the result that we're seeking.
Okay.
One is it's new and unknown. So I don't care if it's a new gym shoe, a new medicine, or a new university. The newness of something is itself a catalyst that makes people resist it.
Okay.
Because we are we've never learned in the global public point by point about anything new. This has never happened before. And you all know in science, when you learn, and then you learn something else that changes the thing you learned before, and then you shift over here, right? You guys, I'm not a clinician or a practitioner. So when we're all learning together about something new and they're like, see, you're wrong about that. That's number one. It's just the nature of it. The second thing is this. We've also not raised at least 2 generations of people to sacrifice for the public good.
Okay.
Wow.
Think about it.
Right.
I'm the last year of the boomers. I'm showing my age. But post boomers, show me an instance where we had to sacrifice for the public
the greater
good.
Not
a war. Not even Afghanistan was over there.
And it was volunteer army.
So we have raised people who we have told you can individualize your TV, you can individualize your radio, you can wear the left earring like this and the right earring like that. So we raise people not to sacrifice for the public good. Third thing is this. We have segments of people just like anything else. I used to work for Procter & Gamble. The reason that Procter & Gamble sells 7, 8, 9 detergents is because the people who like Gain don't like Tide. And understanding, they don't. I mean, the Gain smells, I don't even know how people use it, but anyway. So we have to understand and be rigorous in our analysis to say, we say on the one hand, we're not a monolith, but then understand what that means. We have different segments of people who are motivated by different things. That was the third thing. The fourth thing is that we are not at the stage in the pandemic that we were 5 months ago, even 5 days ago. So as the challenge changes, the ways of being effective change. It's fluid. Public health, governments are not structured to be fluid. And lastly, I'll say this. Somebody said something about if we value life. I think you meant life for me is different than life for you. Life for me is my child. Because that's it. She's everything. She's my why. I'm a single mom, sole provider, can't go down under any circumstances. If I go down, I'm still keep it moving, right?
Right.
But life for the 25-year-old single person who has a good income, lives on their own, likes to travel, hasn't gotten sick yet. Y'all said it was for the elderly. Life for that person is different. They value life. And what we learned, we had a young Black health advisory council we put together, 18 to 39. So we said, what is it, y'all? Tell us what it is. And they value 3 things. Don't stop me from doing whatever it is I want to do. If you tell me that COVID or not getting a vaccine will get in the way of something, meaning my job, my cash, my schooling, or my ability to be with my friends, I'm a listen. Second thing is, if it messes with the way I show up, you tell me I can lose my hair, you tell me something else can happen, I'm with you. And the third thing is, if you tell me I have to do it because you told me I had to do it. We had a mother of a toddler who was living with her boyfriend. She said, we will never get vaccinated, even though my boyfriend has COVID right now, even though we're living this. I said, tell me more about that. And she said, because even the decision to get sick is my decision. So there's nothing you can say to me. That's what I want. I'm 23 or whatever it was. She said, I want it to be my decision. Even if my child gets sick, it's my decision. It's not yours. It's not the government. So I'm giving you the answer to the question, which is that it's not, we have to seek first to understand, like Stephen Covey said, and then seek it every day. Like I never thought I would be in a business. I'm 24/7 on this phone because the thing I learned yesterday is no longer relevant today.
Right.
That variant is eating us up, not like Delta, not like Omicron. The fact that you can test for it and know that you have it in 48 hours or less, that wasn't Delta and Omicron. Right?
Right.
And to your point, we don't even know what the long-term effects are. But if I'm 23 and I'm living life, I'm going to worry about that later. Right.
Well,
so that's the long answer to your question, that it's not a thing. It's a constant process of learning and realizing we are so far into this that those who are left and are dug into their whatever it is that we feel their resistance is, it's going to be an ongoing conversation that builds trust and acknowledges the validity of where they are. Stop telling folks what to do.
That's why you're going to love the way the Cutting Edge and the whole barbershop project works, because you know what? People come back and sit in that chair on a routine basis, and the barbers and stylists have an opportunity to have that conversation. And in the Cutting Edge, we'll learn more about how to keep the conversation going rather than having that conversation shut down.
Right.
I'm glad you didn't shame her. Did you notice? She didn't shame her. She didn't blame her. Val said, tell me more about that. She listened.
Hold up. Let me tell you something. Attorney Davis don't mind letting you know what she think now. You know, you can be nice. I already see that. She tell you what it is. You know what I mean? She ain't shy about that. Let's find out how people thinking and what they're feeling. Dr. T, let's do the word cloud.
Well, we have our 2 new guests here. No, one of the things that we do is that we want you to think about a word right now. And this is for the audience out there in cyber world, social media, that best describes how you're feeling at this moment in the pandemic. And then drop it in the text box. And out there in cyberspace, you can use the question and answer box. Drop that word in, and then drop as many words that come to mind for the next 30 seconds. Keep it going. Just drop those words in, and we will have our crew build a cloud, and it will give us a pulse beat of how this audience is feeling. And we've done this every show. And over time, as you mentioned, Val, we see the ebb and flow as the pandemic ebbs and flows in this word cloud. It's an amazing way to get a pulse beat.
Yeah. Well, let's bring up our resident physician, Dr. Carol Ritter. And she is a OBGYN physician, but she's been with us since the beginning. She is an integral part of what we do. She's a what we call a sister girl as well.
And you know, she takes the messages of the cutting edge to other tables, like the Maryland State Medical Society. And we're trying to move these systems along. Welcome, Dr. Ritter. Good to see you.
Thank
Hey.
you. Thank you. It's really good to be here again. I always look forward to these because they do inspire me in the midst of chaos that I live in this world of medicine. I had to go off a couple of times because you're talking about your daughter, Stavis, but my son is calling me. I have a daughter too, but my son is he's got a very feminine. He's the son of a gynecologist. So
He's the son of a gun, huh?
he's the son of a gun.
A gynecologist.
Yeah, and he's a first year new doctor, and he's having troubles. I mean, he's called me multiple times this week because he's just calling now. I don't think I have enough energy to call these patients and do my notes, and I've had so many people die on me today, and he's like, I had to talk him down, you know. So like, he's suffering, and I'm suffering as a result. So, I mean, I haven't really been totally here.
Right.
But I've had, like, this week, so many long haul COVID patients come in who have the same story. I've been to 70 doctors. They've given me 100 prescriptions and they haven't fixed me.
Mhm.
Right. That's where we are. And it's like, okay, yeah, COVID is still here, and it will be here forever.
Yeah.
Forever, you know, and we just have to figure out how to not be afraid of it and not blame each other, and listen. That's why I'm here, to listen, because the more stories we hear about this, the more we can kind of figure it out for ourselves.
Yeah. You know, one of the things,
Can
one of
I
the things,
say
go
something?
ahead, Attorney Davis, go ahead.
Okay, I'm a lawyer, not an attorney. There's a difference, but thank you for making me one. But that just means I went to law
A
school.
lawyer, you know,
I'm a lawyer.
tell
I
me
had
the
no-
difference. Tell me the difference.
I didn't take the bar. I didn't
Not
plan to
the
practice.
bar.
So she's
Oh,
an
okay.
attorney. Snaps up. I'm like most people who went to law school and never took the bar. That's me.
Okay, that's you.
It's
Okay.
not
Not even-
that too.
Well, snaps on that too. I mean, anybody go if you go to law
It's not-
school. I mean, you can even walk into school. I'm happy for you.
Well, thank you.
Not for
But
the faint of heart. Exactly.
thank you for that. So let me just say something to Carol, because this is, I have to go put my elevate her hat on for this moment. So you looking at me, Carol? Because I'm looking at you.
I am looking at you.
You were made for this moment. You hear me?
I hear you. I hear
You
you.
were made to be his mother. He was made to be your son. Don't even question it. And the times when it gets like this, I don't know what your faith system is, but mine tells me that I'm resting in the big, strong hands of the one who created me. So sometimes you just have to rest and know that his creator loves him better than you ever could, and you too. So just keep breathing. Just keep
Mm.
breathing.
Yeah.
Thank you. You know, you said the word that really we're struggling with is trust, right? If you
Right.
can't trust yourself, he doesn't trust himself right now.
Right.
Imagine if you can't trust yourself, because he's like, you know, Dr. T talks about, you know, having a mentor instead of a tormentor. He has a tormentor right now.
Mhm.
That's the way healthcare is. It's a bully culture, but everybody's afraid, right? So he doesn't trust himself. So yeah, so I feel like I'm here because he trusts me.
He does
Right?
trust you.
You got to have
Yeah.
a
Good.
foundation somewhere.
Yeah.
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 And,
I think that's beautiful that he can call his mom.
Right.
And then his
happens
mom's
to
on the
be a
cutting
physician
edge.
too. So she certainly
yeah, out
can
there for all
empathize.
mothers, right? You know,
Yeah,
if you could
yeah.
trust your mother, you know, your life is blessed.
Yeah.
I think it elevates the mental health struggle that this pandemic has added to the trauma that we all are dealing with in our everyday lives, but the mental anguish that has been a part of the isolation and quarantine period, and how it really helped us
Absolutely.
to identify some of the things that we don't pay attention to because we're so busy moving. But when we had to sit still for a moment and actually be with ourselves and wrestle with some of these things, we started to understand that this is an area of our health that we got to pay a whole lot more attention to.
Mm-hmm.
Right.
And it makes me think about Madam Justice Jackson. I know I'm premature, but I speak those things.
No, you know, she's already justice. I mean, we can let's go on and just say it.
Right.
Come on. She there.
Justice
She
Jackson.
there. She there. She in the house.
Right.
Okay, go ahead.
When I think about what she must have to do to get herself together now, just like forget being on the Supreme Court, but just to recover from the global viewing of people who tried to eviscerate her. Like, how do you do that and keep getting up? And so I'm gonna read you something. It's real quick. It says, the strong Black woman or superwoman role has been highlighted as a phenomenon influencing African-American women's experiences and reports of stress. Basically, prioritization of caregiving of others is a role of caregiving that really is the prioritization of others over self. That's when it ends up being, and that's how women describe it. Black women who report that their loved ones are experiencing stressors are carrying those stressors and responding to them emotionally as if it's our own stress.
Wow.
So I'm just thinking about what she's carrying, like what we've all put on her. Yes, we say, oh, the first, and oh, that thing has got to be bananas.
Right.
And add to it whatever's getting ready to happen with COVID, and add to it that she's raising a young daughter. And so to the point about self-care, when I think about your barbers and your stylists and the fact that they're still here through the pandemic, that thing gets me together.
Yeah. You know what's so interesting? I wonder oftentimes about, do we ever think about the vicarious trauma that we internalize based on the trauma that's heaped upon us through our environment? Not just what we go through as individuals, but our loved ones and coworkers and clients and all of that. Even the barbers and the stylists, they are listening to everybody's problems every day, right? And so they're internalizing it as well. And then they have to deal with their own personal issues. Then they have to go home to many times they have issues there. And so it becomes compounded. And so vicarious trauma can lead to compassion fatigue.
Yes.
Right.
And
out of self-preservation.
That's right.
That I can't even care anymore because I'm trying to live. It's just so much on me. It's like the straw that broke the camel's back.
That's right.
And so when Dr. Ritter, as positive as I know she tries to be in this space because of how we are, I feel her pain.
Yes.
Right. And Dr. Ritter, I want you to know we absolutely adore you. We love you, and we're going to be always here for you every second of the day. You got it?
And
We absolutely love you.
You let
So
your
you have a
son-
support system. This is your family.
That's right. You let him know you have a reservoir to come to replenish yourself right here.
Absolutely.
All right.
Good.
I
Let's
really
let's go back.
appreciate
Let's
that.
go to the let's see what we think, man. We kind of we
Here we
Lord
go.
knows,
Here we go.
we exhausted, man.
Look at this.
We're challenged, exhausted. Some people expired determined.
There
It's
we go.
I think that when you look at it, it's the plethora of different emotions that we all go through, and we are all experiencing all of them. But if you notice, the ones that are largest are the ones that the most people said. And so
Yes.
challenged, exhausted, inspired, and to be inspired is to breathe life into whatever it is you're doing, to inspire it. And of course, to be determined, resiliency, that I ain't gonna let nobody turn me around.
There we go.
Right.
And we've been
that's
here.
the kind of spirit that we're going through. And so let's do this. We got some more people. Dr. Ritter, I'm just so happy to see you, and thank you so much, because I think oftentimes Lawyer Davis, we got to really take care of those people who are on the front line. I think sometimes we just say that's your job, right? When people are coming in repeatedly who've not been vaccinated,
yes,
and they're clogging up the hospital systems and those kinds of things, people who are not getting care that they would need to get because they don't have the capacity because of being inundated by COVID patients. There are people who've died, not because of COVID, but because they didn't have access, because COVID occupied so much of the capacity of these hospitals, and particularly in local small communities, right? So how do we get to the point where we are intentional about taking care of those people who are taking care of people?
And we've watched them go from heroes. Don't you remember we come out, clap, airplanes fly over, to villains, where people coming in infected, demanding now vaccinate me, or give me warming medicine, and fighting the physicians. The death toll is great. And even in this space, we've had people come when we brought the psychologists in to say that just coming to this space, to have a space, is rejuvenating. So let's figure out how we now take this Zoom, elevate her, emerge. However many women came together on what? They came together on Zoom. This thing was here before the pandemic. Let's use it as a tool to organize, just like our ancestors organized, start organizations, build coalitions, and not let this go away. It's not, hey, what's our title, Omar? Spring has sprung, but
Absolutely.
COVID ain't done.
That's right. Absolutely. I really want, because, obviously, Ms. Davis come from a spirit space, and it's important that we become sensitized to, the trauma that we all experience. And then I want to go to, we're gonna bring up some barbers and stylists as well, but I want to talk, once you speak to that, then Attorney James, I want you to speak of trust, because trust is a calculated risk, and the distrust, particularly in the African American community, may have had some impact on our our behavior as it relates to, or our adaptation or receptivity to what is being proposed by government. So start with you, Ms. Davis, and then we'll go from there.
Val, you're on.
Well, I'm stuck on the word cloud for a minute, because the little pieces that I read, the one that I want to focus on is love.
Okay.
In response to what you're teeing up.
Go and put the word cloud back up while as she talked,
Okay.
because I want
It was
I want
over
that to
on
be,
the right side
Yeah.
in the corner.
it's
I
going to
think.
put it up. That's good. We can
And
put it right
each
back
of
up.
you can speak to that, because that cloud is a reflection of the pulse beat of everybody out here listening to us.
Right. And I was right before this call, I was talking to a group in Cincinnati called Natty Votes. And this is a group of mostly Black men who are highly committed to figuring out how to get Black folks in Cincinnati to exercise the power of their vote as an act of health.
Mhm.
And frankly, they were very frustrated because there was one precinct in the last election neighborhood where they had 1,000 votes that could have come behind some Black candidates. And because, well, I'm not going to say because, but the weather was bad on election day, and there were 25 people who voted out of the 1,000 people. And they were just saying, I think, is it that they just don't care? And there's love right in the middle.
Yes.
And what I said, our job is, if we purport to be doing anything around health, any of the social and structural determinants, is to figure out where people's love is centered.
Right.
Because everybody wants love, wants to be loved, and loves something or someone. So before we go to what folks aren't doing, or why aren't you fill in the blank, or you ought to be blah, 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 let's understand where their love is centered without judgment.
Mhm.
Mhm.
And understand what it takes to be in that place in this moment, because we've never been here before.
Mm-mm.
We've never been here before, with the multiplicity of extended, complex, traumatic, multiple pandemics that are upon us, particularly as Black people. So no one's supposed to have this down.
Mhm.
No one's supposed to have figured this out.
Mhm.
Let's all give us a huge measure of grace. Operate with the fierce urgency of now, but with a slathering of grace, and
Mhm.
just sit and understand what is it that you really care about.
Mhm.
Just talk to me about that, and especially with our children, because we screwed this world up for them. They didn't do it to themselves. We did it, and now they have to live in it. And so I'm very much. You said I'm coming from a spirit place, because when it gets hard, and y'all know what I mean by like that really hard place, where you're doing everything you could possibly do, whether it's for your relative or your child, your job, your neighborhood, you've done everything, church. It's your spirit that will get you up. It's the thing you can't see, you can't grasp, you can't go buy from a store, that says, I am fearfully and wonderfully made, and no one can tell me otherwise. So I'm going to cry my cry, change my pillowcase, and figure, since I was blessed with a tomorrow, I'm going to get up and do something. It doesn't have to be perfect. It doesn't have to be on time. It doesn't have to be big. It just has to be what I'm supposed to do. So I'm just going to speak for a minute to the barbershops and the salon owners. Do not let anyone despise what you do, because you know what you do for community. You're anchors. And the fact that you stayed the course and you're still here, you're huge. You mean so much to us ancestrally, culturally, psychologically, financially, educationally. You're huge. And I'm going to say this. When you're asked to do the work, hold out your hand. Because what I'm tired of is folks coming to our community to solve the problems of our community that's not caused by our community for free.
Mm-hmm.
That's not equity.
Facts.
I agree with you. Amen.
I'm sorry, I'm going to be quiet.
I'm just glad
you're
we
fine.
ain't playing. We got the
You-
Warriors here.
But let me say this. We talked about trusted information centers, and Attorney James, you're talking to barbershops and hair salons around the country. And we know that you make your friends before you need them, right? And, Ms. Davis is correct when she says that, if you're going to ask us to do something in our community and you have resources available to do that, you don't give us, we don't have to be altruistic and do things for free when everybody else getting paid. And that's a problem. But I want to speak to the point of trust. And it's not always the message, it's the messenger too.
Right.
Because you can have the message from the wrong messenger and it's not received well. Speak from that vantage point, Attorney James.
I think you're so right. It's not only having trusted health messages, but you have to have have a credibility of trustworthiness to carry that message. Mm-hmm. And there have been, while we understand the novelty of this virus, so that things do change, but I think in messaging around COVID, when we got out front of it, people made emphatic statements about what people should do in a way that postulated that they knew exactly how this virus was going to move. And I think we as professionals do ourselves and the community a disservice when we can't just say, I don't know.
That's humility.
I really don't know.
Right.
Yep.
But based upon what I know about other similar diseases, this is my best guess.
Mm-hmm.
And I'm going to stay here and learn it with you.
Okay.
And that's trust. And I think in order to build trust, you got to show people that you have the humility to put your ego to the side and be clear about what you know and what you don't know, what you're guessing about and what you truly believe. And, I always say to people that I'm never going to tell you something that I wouldn't tell my own mother. I wouldn't tell my friend or my sister. I would not give you a message that I don't believe myself. And if I'm telling you something, well, this is what I read and this is what the evidence is saying today, that's all I have. But I think we have too many times, and we had too many people who got into big spaces on CNN and other spaces and gave messages as if they knew that this was absolutely the answer to how to resolve this problem. And when that answer was not accurate, then they came back 2 weeks later with a different answer and did not expect people to call them on it. Right. Still want people to just accept what I'm saying because I say it. And, no matter how many initials you have after your name, we all are learning. This is a novel disease. There's no way that you could have definitive knowledge about something that you've never experienced before. And I think until we can actually say that and continue to say that and help people to understand that we're not trying to lead you down a path that is wrong, we know to be wrong. This is our best guess today based on information we have available today. And I think being more trustworthy in the way we deliver those messages will go a long way to build trust again in some communities. Now, and I do believe, speaking to those people who have been, those family doctors, those nurses that have been in those communities and have been there with them through their cancer, through their diabetes, through all the other things that they struggle with, those people are the most trusted in those communities. And sometimes that's a community health worker. Sometimes that's a minister. Sometimes it is the person that you talk to at a barbershop who she got a cousin who works at the health department. So you ask her questions
right.
and have her double check it with her cousin that work at the health department. Okay. But those are places that we create. That's the community that we create to figure out what we trust. What do you think about this information? I think the salon and the barbershop are the best spaces for that because you have the whole different perspectives that are in there, all walks of life that are saying, no, because my cousin who work over here told me something different. And this is why. Right. And they will litmus test those answers real fast.
Let's go into the barbershop. Dynamite Mike Brown. Let's bring him into the house. And Dr. Cooper, you on deck. So be ready to hang out with me in just a minute. Dynamite, what's happening, man? How you doing?
Hey, man, Neil, how are you?
Good. You all, I say oftentimes, how I feel about you. I absolutely love you, brother. And I love all of the
Likewise.
barbers and stylists around this country for all you do, both seen and unseen. But I want you, based on the conversation that we've had today, what are you gleaming from this space?
Val Davis, I mean, she speaks from a spiritual standpoint, and I definitely resonate with her in her, especially when she broke it down with the 5 points. I think her number three one is what really resonated with me. She definitely.
Let me say, Mike, can you bring that music down?
I'm sorry.
That's okay. There we go.
Mike, but that's the barbershop, man. You don't be stopping the groove on a barbershop. What's wrong with you?
I didn't see
nobody
nobody
that
in the
kind
chair.
of right. I know. Hey,
no,
you got that kind of right. That man got that man in the barbershop.
You trying to bring home the bag, y'all?
The disco. That's a disco. I'm just kidding. Go ahead.
She definitely understands the different attitudes of clientels that we deal with, especially concerning COVID. It's a lot of people that you're telling them 1 + 1 is 1, and that no, it's not, because I said it's not, and nobody's going to tell me that it is. So dealing with that situation, it shows that she can identify with what we go through, the daily stresses of trying to make people understand that the vaccines aren't trying to hurt you, is to save everyone. So for her to really see that is because it's really frustrating when you get some people and they just don't want to get it, and you get other people that are listening to them and believing what they're saying and not listening to the truth. It gets real frustrating and you get tired, exhausted, but you got to keep fighting. It's a daily fight. So it was very good to hear that she could understand, and not being in here, but understand from the outside looking in.
Yeah.
Mike, tell our guests a little bit about who you are, just a thumbnail.
I'm Mike Brown. I'm a certified community healthcare worker by the state of Maryland. I'm also the manager of the shop spa here. And I've been with the hair program since it was in the nucleus stage. And it's just been an awesome journey to watch it grow and be a part of it. Just honored to be here.
And that nucleus stage was 10+ years ago. Okay. COVID hit, we were ready. As the mayor said, we made our friends before we needed them in the crisis. We didn't know we'd have a crisis, but when we had it, we were ready.
Absolutely. Yeah. And you're talking about people on the front line. They're on the front line.
Yes.
Let's bring Dr. Sharon Cooper up. Hey, Dr. Cooper, how are you doing?
Good evening, everyone. All is well. All is well.
Yeah.
I just want to add on to what folks had said earlier. When we look at mental health, it's just a powerful reminder that our history has caused such psychological damage. And this is why it is so essential that we build that model of mental health, behavioral health into this equation. And the other thing I want to mention real quickly is the need for community engagement. I attended a conference last week with a consortium of university public health service or public service organizations. And that common theme was community engagement, problem solving by engaging the community. And then the last thing as far as capacity building. And yes, Mike, Katrina, Fred, Andre, Dorothy, all you all are just remarkable. Through the vision, through our visionary, Dr. Thomas, we have been able to generate knowledge and contribute to better programs and initiatives to bridge disparity gaps. And not only did we cover, or Dr. Thomas and this initiative cover the COVID issues, but other issues, those comorbidities, Mayor Neal, that you spoke about, such as diabetes, which is prevalent in our community, such as, heart disease, hypertension. But now we're also other challenges such as maternal child health and those disparities. So this is all encompassing, and it's just, again, through this visionary person that we've had the honor of working with, and Mayor Neal, you helping to facilitate this process. Thank you all, and allowing me to be a part of it.
Absolutely. You're so welcome. And we are so appreciative of you, Dr. Cooper, for all you do as well. I mean, you've been a part of us, and you are a very integral part of
I
us.
feel a part of the family, yes.
You are part of the family. Meg Jordan, come on up with us. We want to, I was talking with our technical director about ways that we can make this make sense, particularly as it relates to boosting the booster, getting people protected and prepared to take care of themselves, giving them the proper information. And so I say, in the context of this conversation, what does our public health minute say?
Okay. Do you want me to do it without the slides?
No. There we go.
No, just go ahead. Go ahead.
Because I have a different answer now than when I built these. It's such a different
but
way.
you know what? But you know what? I want you to flow. But and that's why this is so dynamic. But you can do that and share the knowledge, because we need people to get the proper knowledge, and then I'll contextualize it afterwards. What about that? Okay, go ahead.
Okay. So today we're going to keep talking about boosters. So we talked about who needs to get them. So just again, if you are 12 to 50, you can get one booster. You can get it 5 months after your initial vaccination. If you are 50 years or older, you can get 2 boosters, and you should get 2 boosters, one 5 months later, one 4 months later. Okay. So I also want to talk about BA2, Omicron 2. It's the new variant. This is what COVID is now. It is 85% of cases worldwide, and that was a week ago. So BA2 is COVID now, and it spreads even faster. So one person who has COVID can turn into 12, and that 12 turns into 144, because one infection turns into 12.
To stay there just for a moment, because this is where this thing is so different, and we haven't seen it before. When you talk to the infectious disease docs, they say most airborne infectious diseases are spread largely by people who have what? Symptoms, coughing, sneezing on you. This is the first time we have one that's spread primarily by people who are asymptomatic, no symptoms. One person infects 12.
Wow.
Right.
Yeah.
Okay, Meg, keep your flow.
Go ahead.
Okay. So that's the context I wanted to bring before we talk about boosters, right? Because you've got your 2 shots, and those did a lot for you. So when we think about your original 2 shots, how much did they protect you against BA2? They do tests. So they go backwards and they say, okay, those old vaccines, how well do they work against new variants? They go back and they test and they test and they test. So the original vaccines were about 67% effective, right? So a little bit less than that original, that 94 we all loved. But the effectiveness goes down, right? So at that red line, that's where you should get your first booster. And look at that, it slams right back up. It's better than when you first got vaccinated. So that booster really is more. It's not just getting you back up to where you were, it's getting you up and above.
Wow.
And that's what I really wanted to say tonight.
Right.
That's your public health minute.
Thanks.
Mayor,
Thanks over. Yeah.
You've talked about booster, and I think Meg's hit the nail on the head. There will be breakthroughs. In other words, people who are vaccinated who get infected, hopefully they won't die. They're not likely to die or end up in a hospital. But the booster is the key for that level of protection.
Right. And I think that has to be the message. And I don't know why it's like we stop talking to people. This virus is not going anywhere. It hasn't gone anywhere, nor is it going anywhere. And so we have to be vigilant. We have to keep people conscious, because out of sight, out of mind, right? And so that's the work we have to do. And it's important that we do that work. Let me see, Dorothy Reynolds, bring her up. Let's go all the way to Arkansas.
Pine Bluffs, Arkansas.
You got it. Now you did. I'm so glad you got that right.
Finally.
Hey, Dorothy. after 12 years. All right, go ahead. Hey, Dorothy Reynolds, how are you doing?
I'm doing fine. It's good to see all of you again. I took a break away trying to complete taxes and then working on another project. And as someone said earlier, we are still seeing people come into the beauty and barber shops that have had the vaccination, but they're still having contracted the virus, thank God they're not passing. They some of them are asymptomatic, and they're passing the virus on to others without knowing it.
Mhm.
So our health department in Little Rock asked me if I would help them with another project, and I did. And it's Arkansas Barbers and Beauty Shop Health Outreach Program, and we're doing it on next Saturday. And it's a health screening program that will address the underlying causes for that people pass after having the virus, such as breathing problems, strokes, diabetes, complications with kidney failure, heart attacks, and HIV and AIDS, I've been told, has come back very strong.
Mhm.
So we will be conducting tests for HIV and AIDS and providing counseling if anyone is positive. And we'll be doing blood sugar screening, as well as the screening for high blood pressure.
Now, Ms. Reynolds, remind us again who your clinical partner is.
My clinical partner,
Yeah, who's
Is,
going to come in and do these things?
the state health department.
Okay, the state health department. I just wanted to reiterate that for our guests, and I wanted our guests also to know that Miss Reynolds was not into any of this and has been a star all over the state of Arkansas. So let's give her some snaps.
Absolutely.
And let me ask you this, Miss Reynolds, you heard Val Davis when they come. Did you put your hand out? Did they actually help cover some of the costs? Did they compensate you? Did they take care of your clients?
Yes.
All right, let's snap for that.
Well, the point of the matter is she shouldn't have to put her hand out. They
That's
should
right.
come with the resources if they have it, right? So
Actually,
people
the
shouldn't
city,
have to. Yeah.
the city of Pine Bluff is giving a $25 gift card to anybody that comes in. And our beauty and barbershop is providing food and water for anyone that comes in. And the state health department is giving t-shirts to anyone that comes in.
Okay.
And counseling is free. And we have homeless people that comes from the Salvation Army and the Women's Shelter, and we provide free service to them, free hair care. I recently got my license to be a stylist. I'm a health educator.
Come on, give it up.
Absolutely.
We got some more out there.
By profession.
Yeah.
I never thought I would be doing this, but because I had after retiring, I put everything on the back burner to attend to the hair care business, but I never put the two together until we ran into the virus.
Oh, wow.
Well, we're so glad to have you here.
Thank you, Dr. Thomas, for that.
Yeah,
Absolutely.
Go ahead. Go ahead, Dorothy.
Thank you all for the encouragement, because I didn't realize how much an undertaking it was when I started, but because of so many people around me that have had the virus, one passed and the other survived, but you don't want to see anybody with it. So as many people as you can get the word out to and get information to them, the better we'll all be.
Yeah.
Thank you.
I agree with that. You know, we do you know we have like 6 minutes left.
You got a whole bunch of people to get up here.
I gotta get Andre.
Come on up, Andre.
Stacy, I gotta get you up. So I got a whole lot of folk I gotta get up. Hey, Andre Russell, how you doing, man? What's going on?
I'm doing fine, sir. You have earned a place on my wall at the airport barbershop in Atlanta. Even though I would have loved to see you in a tie, but with your t-shirt on,
Hey, man, you know, I was repping my other show, you know, so I that was intentional.
Well, as soon as I get them all printed up properly, I'm going to send some out to Meg so you can put them wherever you want to.
Well, what I'm going to do
great.
is the next time I'm in the airport, I'm going to make sure I wear a suit and tie. I'm going to go by and take another photo so you can replace that one or you have to, right? So,
Well,
so
we do have a VIP room where you can do that inside the barbershop.
all right, that's the gold wall that you were talking about.
No, the gold wall is out in the front. You should have seen that before you said anything else.
Oh, okay. You know,
Yeah. But now I did see something. I'm not going to try and have you cut me off. I saw something on Facebook today about a friend of mine he's a current friend, but it seems like a long time talking about vaccines and vaccinations. And I said, well, let me share this along my line, and come to find out it was somebody from the University of Maryland, Dr. T.
What?
Man, I'm telling you, this is
I did not know how
he
he even ended up in my line, but I put it right on out there. However, I only gave it about 30 seconds worth of attention, but I spread it right out when I found out who it was.
Well, you know, you're a busy man, so you know, 30 seconds for you is like a lifetime for a lot of folks, you know.
So I'd like to also say that I hate to put it like this, but all of these females that are exploiting themselves and doing all these positive things, lawyers, attorneys, doctors, as well as now Supreme Court justices. This is a wonderful thing for them to be represented with us while we're doing what we're doing.
Yes.
And I am proud to be a part of this. And I'm looking forward for it to be going further on and our next project, whatever that may be.
Absolutely.
And I didn't mean to use exploit. Did I say exploit?
No.
Well, you know, that's okay. We know your heart. So we're going to take it in that context.
I saw this funny look on Attorney Davis's face. That's wait, I did the wrong word.
Well, you know how the attorneys the words matter.
Exactly, right?
Yeah. Words matter too. You know. All right, so
okay. Thank you guys.
He didn't mean it that way. Let's go with Stacy and Rejuvenate. Hey, Stacy, how you doing? What's happening in the Philly area?
Everything is pretty cool out here. I'm just looking forward to having the next vaccine clinic with the barber, 11-year-old barber. So I got information from Meg today. So I'm working on that with Giant or Walmart. And everything else is pretty good. I really enjoyed the call today because I really didn't pat myself on the back for having this will be our third one. But
come on.
No, but you can. I mean, we want people to really
clinics.
Share that information because you remember when we were talking about, I don't know if Ms. Davis said it, but when people see things, then they give you permission to do it. When she wore her hair, others were watching, and it encouraged them. So as we do things, let's promote it, right?
Absolutely.
We talked about promoting our protection. Right, we have to promote our promotion.
There you go.
Right, go ahead. Continue. We have a few minutes for you. Go ahead.
Yeah. So I just wanted to. It's really more so like you guys helped me a lot because I really never thought about I was doing something that much because someone said to me today, they was like, "You still talking about the vaccinations?" I said, "It's still here, isn't it?" Today.
See?
And so they come in and they say, "Do I still have to wear a mask?" I said, "When you walk through Rejuvenate, you have to wear a mask." So I'm still keeping. I'm a trailblazer. I'm going to be here with you guys. I'm going to do everything I can here. And I told her I have an open door. If you want to have something, I have the space. We can have 100 vaccination clinics here. I don't care if it's every week, every day, whatever it takes to get people safe and stay alive.
All right.
Thank you so much. Thanks so much, Stacy at Rejuvenate in Philadelphia. Well, you know, the clock on the wall says it's time for us to giddy up out of here. Let me say this. Let me say some kudos to Tuskegee University. Tuskegee University is truly engaged in the community as leaders, and access to shots from at the university is it's done at Tuskegee University, and the community can come and get their shots. I was talking just this week at our weekly meeting, and I asked Attorney James that question about the booster, and she says, so Attorney James, just take 30 seconds to talk about how Tuskegee University is engaging the community, not just the Tuskegee University community in the campus, but the entire community.
Well, since the beginning of the pandemic and even before then, we are true to the mission of our founder of that. If we get this education in order to uplift the entire community. So as far for our COVID-19, we offer free testing, and we have weekly vaccination clinics that are open to the community to come onto campus and to get their vaccine and the boosters. We are a certified COVID laboratory. We have our CLIA certification, as well as we are a vaccination storage facility for the entire state. So we will actually resource vaccines out to any community-based organization that wants to hold a clinic. We have the -80 refrigeration that we will provide them with the vaccine, so they don't have to worry about trying to figure out where to get it from the state. So if you need vaccines and you want to have a clinic, we will help facilitate that, as well as make sure that we'll have a clinic on campus where you can come if you don't have another place to get it.
Amazing.
Well, amazing. That's what it's all about. That's what it's all about. That was my late mother would always say, son, that's what it's all about. Well, the clock on the wall has summoned us to bring this to a close. I'd like to thank each of you. To my lawyer, I'm gonna always call you Lawyer Val Davis, as the spirit one. Elevate her.
I love it.
I love that concept, and we lift each of you up. We are appreciative of beholding your countenance today. To my dear friend and colleague, Attorney Crystal James, thank you so much for agreeing to come and sharing with us.
Thank you for having me.
Your contribution was immeasurable, and to all of our regulars, from Dr. Cooper and Ms. Reynolds and Mr. Russell and Dynamite Mike and Stacy and all who make up our team, we'd like to thank you for what you do. And of course, we cannot do this without Dr. Carol Ritter, who has been here with us the entire time. I'd like to thank our team behind the scene. To everybody, thank Meg Jordan for all of her work she does, and Maggie and everybody that's behind the scene. I don't want to mention everybody because time does not permit, but I certainly want to thank them for all that they do. Dr. T, you know how much I love you, a brother from another mother, right? And for your leadership in this regard, could not be done without you, right? Thank you so very much. And as always, I'd like to leave you with these two words. Remember that I love you with a perfect love. But more importantly, remember this: you got the power. Until next week on The Cutting Edge, have a wonderful day. And
you got the power.
Bye-bye.